Ladies and gentlemen,
This is the Dental Up Podcast, brought to you by Keating Dental Arts, a full-service, award-winning dental laboratory. Each week, you'll learn tips and techniques from real-world dentists, bringing you in-depth interviews, motivating stories, current events, and sports. Here's your host, Sean Keating.
Hey everybody, Sean Keating here. Welcome to another episode of the Dental Up Podcast. Our guest this week is a graduate from the University of Missouri, Kansas City School of Dentistry, earning his Doctorate of Dental Surgery in 2014. Practicing from Las Cruces, New Mexico, please welcome Dr. Jake Wolf DDS. How's it going, Dr. Wolf?
Living the dream. Having a good day here. We have a pretty easy schedule today. Everything's predictable so far. So can't complain.
Oh, that's so cool, dude. Thank you so much, man, for coming on board, dude. I know you're a busy man, and we can't thank you for the work, all the work you sent us here to Keating Dental Arts, man. We appreciate it, and thanks for coming on board. I know you're quite busy, but I always like to start off with sports. Are you watching any of that World Cup? Are you a soccer guy at all, or no?
I'm not a soccer guy. So I grew up in Kansas. I'm a Jayhawk, and so basketball is kind of my thing. So I've been a little more focused on the where's LeBron going this next year.
Yeah, no kidding, man. He might be coming down here to L.A. if we, I don't know. It's kind of crazy.
It'd be good for the league,
Yeah.
It's not good when the big markets don't have a good team.
Yeah, and
it'd be awesome for Cleveland if he could get somebody else there.
Yeah, I don't know if Cleveland's going to be going to that finals for 4 years in a row without him, but it's a trip how the dude has gone to 8 finals, man, with 3 different teams, or 2 different times with Cleveland, but with Miami also. But man, that's pretty amazing the way he's done that. But yeah, we have quite a few Koreans that work here with us. Some of my ceramists and stuff in South Korea is playing today, and they beat Germany, man. And I couldn't believe that. They're going crazy here in our lunchroom, man. We got these big screens and everything in there, and they were going nuts, man. So South Korea beat Germany, and there's a trip to see Argentina, that Messi dude, yesterday. They finally got a win. And, but yeah, man, that's just, it's kind of crazy that soccer, how I was never a soccer guy. I'm the old football, baseball, and basketball, and then we did track a little bit, but back in my day in the 70s growing up, it was so big, like even Bruce Jenner, in the Olympics, man, 1976, he's the world's greatest athlete. Now he's a woman. Go figure. It's kind of crazy, but
it's crazy, isn't it? Modern times.
It's different times in this world now, man. It's like, good Lord help us.
Yeah.
But let's dental up. So tell me, why did you get into dentistry, and at what point did you think, I want to be a dentist?
Yeah, so that's kind of a funny story. I didn't start in dentistry. I went to business school.
Okay.
And in college, all I wanted to do was go rock climbing. And then I got out of school and didn't really want to get a job. So I lived out of my truck for a couple of years doing odd jobs and rock climbing, mostly out in Yosemite National Park.
No kidding.
And then I got a business job for a couple of years, worked crazy hours, made a good living, but didn't have any time to enjoy it. And I knew a couple of dentists at the time, and they were working 4-day weeks. And I guess I didn't really understand it. And I thought, man, if I become a dentist, I'll just work 4 days and have 3-day weekends every week. That sounds great. Yeah. So that's kind of what I did. I didn't even really know a whole lot about dentistry. And I thought 4 days, I can do anything 4 days a week. So I go to school, and I start my first day at dental school at UMKC, and we got 108 kids in the class. And my last name's Wolf. So I'm kind of at the end of this circle or whatever we're in. Okay. And they have everybody go through and tell why they want to be a dentist. And pretty much everybody in there says, my dentist changed my life. I had crooked teeth and I wasn't confident. And then they sent me to the orthodontist and it changed my life. And it gets to me after all these 107 sob stories. And mine is just, I just want to work 4 days a week. And I think that a lot of the faculty, some of the full-time academics thought I was joking and didn't really know what to say. And then a couple of the old retired guys kind of look around the room, look at me, and kind of nod their head like, yeah.
Can you believe that? That's the first time I've heard that, man. And you went to school for business, so you're a businessman, so you knew business. So that was a pretty good thing to, equate it to, hey, 3-4 days a week, kind of do your own schedule. And you must have been smart. You knew that science and math to be able to get into that dentistry. So that's pretty cool, dude. That's a great story. So tell me, where did you attend school? Tell me a little bit about your journey going through your schooling.
So dental school, I went to UMKC, which, it's changed a lot because they got a new dean. I think the first or second year I was there. I can't really remember. But it was kind of a traditional, like a military school for the most part. It was kind of the tried and true model. I think break them down, and then build them back up type of thing. Lot of need for bread and butter dentistry in Kansas City. Dental schools, inner city. You don't find a lot of general dentists, believe it or not, that do extractions in Kansas City.
Okay.
So a lot of the people that can't afford to go to the oral surgeon end up there. You get a whole lot of reps with surgery, basic surgery, not quite as much with endo. And I think you find that at a lot of schools. You get one or the other.
Okay.
Either the patient population can afford to save the tooth or they got to take it out. At the time, you want to do the cutting edge stuff and you're looking at implants and you want to do veneers and all this stuff like that. And then you get out and you realize that it's kind of a disservice if you're spending some of your hours doing too much of that, because there's a lot more bread and butter out there than there is anything else.
Yes.
And you don't have a lot of time over those 4 years, especially most schools, only 2 of them are clinical really. And that's not a lot of reps to really build up the base skill set that you need to go out and be successful at this on the first day.
Yeah, it's tough. Yeah, I mean, a lot of guys come out of dental school with really no hands-on skills or very little. I mean, I don't know. So I got out and it took me a while to realize that we had a pretty darn good education. We got a lot of reps on the bread and butter stuff. We may not have had a lot of, implant exposure or grafting exposure, but that's stuff that's been pretty easy to pick up outside of school. And, I won't say that I enjoyed my dental school experience because I don't think anybody really does, but I think I got what I paid for, and that's for sure. No kidding. So tell me, did you start out as an associate or did you purchase a practice? Tell me a little bit about that.
I did. When I came out of school, I became an associate for a pediatric group here in Las Cruces, New Mexico.
Okay.
And I think that was a great place to start because, the pediatric dentistry, it's a little bit more forgiving, I think, with some of the mistakes that you might make early on.
Yeah, it's
and
tough.
You get a lot of repetitions because you see a lot of volume. And the group I ended up working for right out of school, they had a really good system and they were able to get kids through comfortably. The whole staff was good with kids. And you really just kind of got the handpiece moving a little bit, got a little bit more repetition than you did with, a standard adult dentistry based associateship, just volume. And then you kind of built up that skill set with the kids, which was nice. And I joined a group in the neighboring town, El Paso, Texas.
Okay.
And it was a guy that at the time had 4 offices in town. And then, it's been 3 or 4 years, and I think he's up to 13 now.
No kidding.
I was there as he was kind of growing and figuring out the system. He gave you clinical control. All of his offices had the same phone systems and the same software, but every dentist practiced exactly the way they wanted to. He handled as much or as little of the staffing and the clinical decisions as you wanted him to, but just a really fun organization to work for. It was just an hour commute each way. And after a couple of years, I decided it was time to buy an office.
No kidding. Good for you, man. And you probably got great experience in some of the bigger practices like that. I love when I hear my dentists, they went to work for an associate, but the bigger practices, it might have been a practice management, or it was just a great experience to be in the trenches like that and then have the confidence to go and start your own. So tell me a little bit about how you found your dental practice. Did you build it out or was it a purchase? Tell me a little bit about that journey.
Yeah. So my practice is actually about a block from my house.
Okay.
And I've driven past it and walked past it for 4 years. And I knew of the dentist because one of my first assistants had worked for her for 20 years. And I finally decided to get in touch with her. And we kind of hit it off, and she was ready to get out and I was ready to get in. And the actual building is what sold me on the practice. It was really dated, but it's on one of the main streets. It's got great visibility, standalone building, 5 ops. pretty standard dual entry, 12 o'clock shelving. And then it had European style or continental delivery that was ancient, from, I think most of the units were from about 83, 84.
You're aging me, man. I started in 84.
In the last, well, that doesn't sound that old, except when you try to get parts for some of that stuff.
Oh, I know. I'm just kidding with you, man. It's come
the
so
dental
far.
manufacturers don't make a whole lot of money on that.
Exactly.
Yeah. So we've been kind of updating as we go, but it was a film in Chart's office. I remember we asked one of the girls to call one of the, I think it was a local lab here in town. And she got out the phone book, and I just couldn't even believe it because they'd never had the internet or computers.
Oh man, no, hey, it happens. I got one of my good friends over in Anaheim here by Disneyland. He bought a practice for it was like 10 grand. He gave the old timer, and this was back in the late 80s, and it's just so old, but he got it for nothing, and he had all these patients, and he just had to update it. But hey. It's better than going out and paying $500,000 or $1 million for a up-to-date prax where you can get it for, 5 cents, 10 cents on the dollar and just update it yourself slowly as you need to. But not good for you. Tell me a little bit about the layout of the practice and all that.
Yeah. So, this is a pretty common layout, and I don't know who the consultant she would have used at the time or the dental architect, but it's a pretty common layout you see for that era where, you've got the lobby, you come through the check-in, check out, and walk through the hygiene, and then do the loop past the restorative operatories and then back out. It's got plenty of space. It's 2,000 square feet for 5 ops. We've got a laundry room. We have a lab. We have a pretty big sterilization room. And then we've got a really large private office and a treatment planning room that's probably oversized as well. But it's one of those offices that I'm kind of a construction guy. And, you go through these places, these old houses that have real good bones. Yeah. They just need some updating, and that's kind of what it is. Everything was built really efficiently. It's just a little outdated.
No kidding. No, that's perfect, dude. That's the way to go, especially, not just taking on so much debt on some super spiffy, shiny dental practice. Make it your own, update it as you can. And heck, you just kind of got into the field, man. When did you graduate? What, 2012 or 14? Good Lord. I got 14. Underwear older than that. No, I don't. So you're just a puppy, baby. No, that's awesome. But you're just rolling. I mean, you're really doing a heck of a job. You got great hands, and no, that's just so cool, dude. So tell me a little bit about what do you like to do? What's your favorite procedure? What do you like doing? You like cutting preps? You like doing endo? You like trying to sink implants? Or what are the do's and don'ts? What do you like? What don't you like to do?
So I think I've got average hands, I think. I've got a good lab. But I think that probably my favorite part of dentistry, I like doing implants and I like doing endo, but I really enjoy emergency dentistry probably more than just about anything else. I think the reason for that is, this job can be pretty tough on you mentally.
Yes.
Because nobody really wants to be there. And, when you get those emergency patients and you can get somebody out of pain or get some swelling drained, those are the people that are really grateful. And it reminds you that, not everybody hates dentists, and it's not all a bad experience. So, and I got to do a lot of that in my El Paso practice. I was in a pretty poor part of town, and I think I had a year where I took out like 5,000 teeth or something like that.
Can you believe that? You just kind of push them. It's weird how
that stuff's a lot of fun.
Yeah, I got a bunch of dentists that they do. It's just different parts of the United States, but some guys, they do a lot of Crown and Bridge, but man, they extract. And I got this one guy, Dr. Murph, man, that's all he does, almost limited to extractions. And he has his little videos, and it kind of almost like you push the teeth out the way you do it. It's kind of weird. But man, it takes a, God,
is that Tommy Murph?
Yeah, Tommy Murph, man.
Yeah.
I love that dude.
He's contributed quite a bit. I'm a big Dental Town guy. I feel like I've had a lot of mentors that I've never actually met from Dental Town, and he's one of the real active guys on there. So
that's so cool. I love hearing that, dude. Is that how you heard of my lab, or it was on Dental Town, or how'd you find out about my dental lab?
It is, yeah. So I don't actually know how you pronounce his last name, but I think it's Kenka, John.
John, Dr. Kenka. Yeah,
the big composite guru.
Yeah, Kenka Bond.
Yeah, and so I've never actually met him, but I feel like I know the guy because I've read just about everything he's ever written, and I use pretty much all his products, and he does quite a bit of posting. A lot of it's on one of the private forums on Dental Town, but he's shown a lot of cases you guys have done. And,
right on. I love
if you can use a good lab, it always makes you a better dentist. So that's certainly been the case for us.
Oh, that's so sweet.
We have issues all the time with things that we're always trying to figure out. And you guys have been real helpful as we've started using you guys exclusively.
That's so cool. And we'll stand by you. We'll help you do practice better dentistry and make you look good in front of the patients. And, whatever we got to do, especially some of the bigger cases, we need to do wax ups or some custom temps for you. Just let me know, man. We'll hook you up in any way we can to make your job easier. That's my whole thing here as a lab. We just try to do it to where we make your job easy when it comes to working with a dental lab, because it's probably 5 to 8% of your overhead, just depends, but it could be 90% of your problems if your lab doesn't do good work. And we try to make it to where you have to worry about other things other than your lab. We should be the bright spot of your practice. And, because you have to work with people in that chair, and it's a tough thing. I have so much respect for dentists out there, what they have to go through daily. And you got to be part psychiatrist, part coach, part buddy. You got to have this, upbeat mentality more so than not with people. Some guys can be cranky and stuff like that and get away with it. But this day and age, these people, it's like the golden rule. I always look at it, you just try to treat people like you want to be treated. And most of my dentists that kind of do that, they're very successful, not only with business, but in life, and I think there's just such a important thing to find your balance between, all that. But now that is so cool. Kankabon, thank you. And Tom Murph, man, that dude, we do fantasy football league each year with this guy, and he's a character, but man, that dude can shuck teeth like the best of them. I think he does, thousands a day over in Guadalajara or wherever he goes. And that's just, I don't have the stomach, man. I see some of those videos, dude, and I'm like, yeah, how could you do this as pussy teeth? And I just imagine I can just smell it. And I got like a gag reflex. Like I can't do a hard shot of liquor or anything. I mean, it touches the punching bag in the back of my mouth there. It touches that and everything wants to come out. That's why I can only drink beer. I'm just a sissy boy, but I can't, I could never be a dentist, man. And I just working on these models all these years. We're working on stone and plastered models, and they feel no pain. And until we got an operatory in our laboratory where we could see all the stuff being placed and the technicians, they get a different feel for it then. I mean, there's a person behind this, and how important that emergence profile is down at the gingival aspect, especially if we're going a little bit subgingival. If you don't have that thing flat or negative profile, you're going to be blanching tissue. You have bulkiness. And the people see it, the buccal lingual widths, the narrow occlusal tables, and, you don't want to be biting on cheeks. But I think our techs really got a lot out of seeing more and more cases going in the mouth. And just seeing the live patient, God, it's a tough field. And some people master it and some people get it down. Some people can't. After a few years into it, they're like, I'm not sure if this is for me. But it's a very rewarding career, but it's pretty demanding. But it can be when you do it right. And, you get the right people you surround yourself with. Take care of them. I mean, like any business, if you do that, I think you'll be successful. But dentistry, it's a tough little field, but it's a very rewarding field. But every day is new. Every day is like you're only as good as your next patient. To have certain people coming through the door is like, man, I don't really want to work on this person who's got a small little mouth and they got this dude's got this fat tongue that goes every which way. And so my hat's off to dentists. I love them. I know what
you guys see that though, because you'll see doctors that we always place 2 chords, and we try to send a really good impression on a good enough prep, and we're always trying to improve. But every now and then you get somebody that sends those just perfect impressions every time, and then you get one that's kind of iffy. But that's one of those patients that you're talking about with the giant mouth and bad gag reflex. And sometimes that's tough for us. You just got to do the best you can. And for you guys, you guys got to do it too. Cause you don't always have everything you'd ideally like. And I love that about your guys' lab. When there's something that's not perfect, we always get a call And I'm one of those people where if I can do anything to make it better, I wanted my partners to tell me about that. And you guys are our lab partner.
Yeah.
So it's always nice to get those phone calls and say, hey, we'd like a little bit more clearance on this. What do you want us to do? We've got some options where we could do a reduction coping, or we could spot the opposing. And I always appreciate those phone calls, because you don't usually get that kind of service in today's day and age. A lot of times you get a case and they've made the decision for you, or they've made something too thin, or whatever it happens to be. There's nothing about this in any aspect of it that's easy.
I love that attitude of you. And I got a lot of doctors that feel that same way as you, but then I've got some that, it's a touchy thing, when you're calling doctors, especially when you don't have a relationship like we do with a lot of our dentists, that as we get to know them and our people, and we get to know each other, and, you build a relationship, because it's what it's all about. I mean, dentists has got so many options for dental labs out there. And just like, so when we're calling a dentist, at the beginning or in a new part of our relationship as we start working, some of them take offense to it. It's like, oh, my other lab did this and this and that. And it's just like, it's hard, like, for us, because we want to say it in a nice way, but it's like, dude, we've got no room. You got this plunger cuss coming down, or it's mostly with impressions, like margins, like it'll be good on the mesial, buccal, and distal, but on the distal lingual area, it's gone. I can bring it across. And when there's certain patients, we understand this so much, that certain patients, like you said, a fat tongue or the small mouth, this and that, a gagger, we know, and the dentist will say, Sean, and more so than not, I think a lot of these dentists know when they send something in and it's not perfect. I don't think they do it on purpose. I think a lot of times it'll be, when they call, they'll say, or they'll even write it on the RX. They'll say, Sean, this one was a tough one. Do what you can. Let me know. And I always say, when I'm talking to my technical advisors and my different managers, their freaking dentist doesn't want to get that patient in, as bad as we don't want to, redo a case.
Yeah.
And it's something, it's just so important that, we know that the dentist realized it and say, hey, Sean, see what you can do on this. At least we got something to go to the mouth to the patient, where they don't look like such a knucklehead where, oh, you got to come back in and take a new impression. I will always say, well, at least let me do this. And I'll do this a few times or several times, depending on, the doctor and how, close they want to work with us. And, if they're feeling what we're feeling, we'll do what we can. We'll go ahead and do the case and give what we think and do the best we can, because this patient was tough, or the doctor is kind of saying it's really going to be hard to get anything much better, but we'll go and do the case. And we'll always tell the doctor, go to the mouth with it. And if it's not exactly perfect, at least you have something to give to the patient better than the temporary that's in there. Let's use this maybe as a temporary, maybe, the occlusion's good, mesial distal contacts are good, but we have a marginal integrity problem. Well, let's just go on with some temp cement. Let's use it as a temp, but let's get a new impression, fresh one. And at least we can make the dentist not look like, well, why didn't you do an impression at that time? Well, at that time it was not feasible. The patient was wiggling or whatever it was. Might have been time. But I love doing that too, and sometimes we get it nailed to where it works and it's good enough, but we don't charge on remakes here. And if something, goes awry in a year or two or whatever, when the doctor's working with us, it's like, hey, we're in business together. We work for these patients together. So what we do for these patients, they pay our bills. So bottom line is we got to make these patients happy. And, we try to do it on the first time, but sometimes it doesn't happen. But when a dentist over and over and over, okay, there's another bad one, but sometimes it's assistants doing it. Sometimes assistants aren't doing when they're doing the temporaries, aren't really keeping them into occlusion or making them broad, full interproximal contacts. Teeth like to shift. Teeth like to drift more than we think. That tooth opposing, if it's not locked into occlusion, man, it's super eruptum. Almost sometimes by the time the patient's out of the chair, it's already dropping. But it definitely in a week or 5, 7, 8 days, it likes to go down and drift a little bit. And so what's on my models and what's in the mouth are two different things. So that's always tough. But it's just great when a dentist, and it's a fine line when we call these guys at the beginning because we don't know. I've had some guys like Sean, and that was back in the days when I did all the calls and stuff. But our people are real sensitive to it. They're sensitive because, heck, man, chair time. I mean, it's $300 to $500 an hour if someone's in that chair or not. With your overhead and everything, and time is money, but. Yeah. It helps so much with, doctors that really want to do it. And then maybe the next time they take a little bit more time just to make sure we got the isolation there. Room's not a problem so much. I mean, we can get away with that. But again, reduction copeaux are really great. But then again, a lot of doctors don't like to numb people up, put the crowns in. Some guys always do it. But, and then again, I don't see the red because once you see the red, you're dead. And I mean, if I'm taking off 2 millimeters of a tooth and I'm going into nerve, I don't feel it on my stone models, but the dentist's like, I can't do, this. Well, it's just, it's tough. There's so many variables between, the dentist and the patient's mouth and our lab, but we nail it pretty much, a lot of the time. But it's it's pretty rare I have to make an adjustment. Yeah, that's so cool because you're doing, which is pretty impressive. That's so cool. I saw a lecture somewhere in that I think they said there's 68 steps to a single unit crown from the impression to the final. You guys may have a different number, but I know it's a lot of steps. Yeah, it is. To think that you can get all those right. Yep. It's kind of amazing, really. It really is. I've been doing it a long time, and it just amazes me. God, it just, it'll suck the life out of you, though, when you get it to where, I mean, I remember when I was having issues with some contaminated metal that, something got in there, or maybe because every time you cast an alloy, you're putting fresh alloy in, but you have buttons that are, when you're cutting off your units, you have an excess button. So you have to, you can't just throw that gold away because you'll get 10 cents on the dollar. So you have to replenish it with your fresh alloy. So there's an art to that of how much new to the button. And what they have in a lot of these alloys is, like indium, iridium, and zinc trace elements. So you have your basic, your golds and your palladiums, but they mix it with trace elements. And it helps with, there's a science to it all with the bonding layer and everything else that you get that forms an oxide layer, because we have to opaque that alloy and then bake a porcelain on it. Yeah. So it's quite a few steps to it, and there's quite a science to making sure if you're too heavy on that torch, you got a reducing zone, an oxidizing zone, and a combustion zone. And you got to keep it right in the middle that you're not getting it oxidized and you're not getting it too hot, because you'll burn out all those trace elements. And so it'll cast, it'll look perfectly, but the compound makeup will not be what it was designed for the bond, and you might have a weaker bond. And so all those times, those PFMs in the back years, well, it pops, like you got 3/10 of metal, and then you got 2/10 of opaque. So you got a 0.5 millimeter, then you build about 1 millimeter or so, or hopefully more, to get a dent and then a size on all this on. And then when you start sandblasting internally and, trying to get your oxide layer after you've baked it and glazed it, you're getting a little thin in an area, 1 to 2 millimeter, 1/10 of a millimeter in there. So when the patient loads up on that crown, you'll have I call it the tin can effect, where it'll pop in one area and it'll pop usually at a margin or, a marginal ridge area if it wasn't supported. So the PFMs, man, they aged me for, many years. I still do quite a few PFMs, but we just got it down to a science now. I mean, we measure liquid powder ratios exactly. We do casting internally, inlays, onlays on expansions internally, outside expansions on every new, box of investment we have. The alloys are, it's always a 90% fresh alloy with 10%. And my casting guys have been with me for 20 plus years. So they're really good at not burning out trace elements. And it's an art to it. But now as we get going digitally, it's pretty amazing how, that whole expansion thing and all that, we don't have to worry about that with the impression material, because we're scanning it and it's so freaking accurate that there's no variables really. It's here. We can go in and add cement spacer. I can go 40 microns, 60 microns, 80 microns allowance for your cement. I mean, I can really tweak things, and I can do things modelless that are more predictable without a model with a CAD/CAM system, it's more predictable than it was in any of my years of doing it conventional loss wax technique on doing regular, crown and bridge. I still love it, but yet now I got it more accurate. I got it to where I got material that doesn't break. There's no flexing. There's no tin can effect. Stuff is like Dick Butkus, it did my ads for my Bruxer. It's freaking hard as a rock. I mean, but the whole thing was aesthetics. And now we've kind of licked that with the aesthetics that I've got. My Bruxer is one of the best Bruxers out there, but my Bruxer aesthetic, it mimics Emax, if not surpasses it. And guys will tell you that. I mean, in the anterior environment, these are blending in like so unbelievable, and the strength is there. And Emax is still a great material. I still do thousands of Emax a month, but it's just something that quite expensive. I have to charge like quite a bit for that, where my monolithics are quite nicely priced. They're not like sending out to China or Vietnam priced, but they're very reasonably priced for dental practices across the U.S. that they can afford these, and they're very beautiful, and it's just a neat thing. It's just how it's evolved. Definitely. And you're on the end of being 2014. You got a lot of good times ahead of you, I think, because a lot of dentists through the years, man, they've got gray hair and bags under their eyes from labs sending them work that it breaks, or even two connectors on my we like to do everything single units and laser weld everything for our connections, because things like to warp and stuff. And that whole thing with porosity, how to learn how to not have porosity. You have to have air vents on your spruing. It's just there's so much to it, but it's so neat now where it's so much more predictable, and it's just a real neat thing. But it's exciting to be in dentistry now going forward. I think it's much more predictable. I think you do things a little bit faster, and it's
predictability is what makes it fun.
Absolutely.
I think if you talk to most dentists, the days when they're having a good day, it's when things go the way they planned. And anything that goes differently makes it kind of a stressful day. So as we can eliminate some of the error, it just makes it easier. Absolutely. But I think that this is also probably, you've been in this a long time, you'd probably tell me that this is probably the cheapest that you could ever get the quality that you're getting right now.
Oh yeah.
On Crown and Bridge.
Our prices
for the cost.
Yeah. I mean, it's from like 1980s, 1990s prices really. It's just so much better though. I mean, it's a better restoration than it was back then, and it's about the same cost. And that's dictated by some of these big commercial ads. But again, at the end of the day, on every dollar, I make about a nickel. It's not a very profitable business I'm in. I just need more dollars, So I make a few nickels now, but I could be doing a lot less and making quarters. But you know what? I'd rather be out to the masses to be able to let them have my products at whatever I can do. The cheapest I can do it is what we do it. I mean, we haven't had a price increase since 2011, and that was just a couple of percent when I did that. And it's just it's amazing that and we've never missed a paycheck for our employees in 16 plus years, and we've never been late on a bill to any of our vendors, and we're just blessed here for sure. Well, dude, I can't thank you. I know we were going to wrap up a short one here. Let me ask you a couple more real quick questions. What do you do for any of your marketing? Are you doing any social media? Do you do any mailings? Tell me a little bit about what you do to drive patients to your practice.
So we're in a growth phase because I bought a practice that was open about 18 hours a week. And, we've been growing over the last 8 months trying to get it back to a full-time practice. And really, this is going to sound old-fashioned, but the very best thing has been word of mouth.
Yes.
When we can treat an emergency and get somebody out of pain, they send 5 people our way within the next week.
Can you believe it?
And, when somebody has a really good experience, or they say, I've never been to the dentist and not felt an injection before, I didn't feel that. You say, hey, you know what you could do to help us out? Just give us a review on Google.
Beautiful.
And, don't be afraid to ask for that when somebody's over the moon. And Google makes a huge difference on your Google business if somebody gives you a 5-star review and they actually type something about it. Those have been the big ones. We've tried some other things, And really, we've just decided that the best growth is taking care of the people in the chair.
Oh, so
and,
true.
And there's still nothing that tops it.
And it's free. And it's just like the best, even for us. I spend so many thousands of dollars in marketing, and still 70%, 60 to 70% of every new doctor I get is a referral from an existing client that is happy. And it's the best way. Take care of your existing people, your existing accounts, and they'll bring practice people to your practice. And that's just so huge. Okay. Last but not least, tell me, what have you done for CE? Your young career, where have you gone? Do you do any seminars? Do you go to any conventions? Tell me a little bit about your CE journey.
Yeah. So I did the first couple of years out, I was on Dental Town religiously. And then I did, let me think, the first year I did the big, a couple of the big conferences, the ADA and some of those. And I did a bunch of them, the weekend ones. And then the second year I was out, I went through, I think it was Implant Direct. They've got a pretty nice facility in Las Vegas, and they have some pretty affordable classes. But I did I think it was 12 weekends in Las Vegas on implant related stuff.
Sweet.
And I did quite a bit on Spears online thing, which is a really great resource, especially for a younger dentist. They've got a lot of CE videos that are very high quality for a really inexpensive cost. And they have a new dentist deal where it's even cheaper than the listed price. I've done quite a bit of stuff. You guys have got some videos that I think David Hornbrook does most of them.
Yeah.
But we watched quite a few of those. There's a whole lot of it. I did the local study club thing for a couple of years. And then I got to the point where I was doing so much CE that I was seeing the same speakers over and over again.
Yeah.
And so I decided I needed to focus on a little bit more of the continuum based
stuff.
Good, and we're kind of getting ready to focus on some more bone grafting this next year is kind of where we're going.
Yeah. Well, Spirit Education, man, we love those guys. They're really knocking it out. And a lot of our younger dentists are going and visiting them, and they're the real deal, man. They help it out. So is Dental Town with their vids, and it's just an awesome thing, man. Just keep growing, keep learning, man. You're young. By the time another 5 years, man, you're gonna have like that dude over in Texas. We'll have you 2 or 3 practices, man. Just working smarter, not harder, baby. You could be bouncing one day here.
I'm a lifestyle guy. I want one practice where patients are happy and people feel like we got time to talk to them. We feel like we're going home at the day having done our best work. We've made enough money to have a good lifestyle. That's what I'm really looking for long term.
Well, Dr. Wolf, that's a great attitude, man. And I have a feeling you're going to have so much success in your life because just the way your attitude is and the way you practice. And I see it, man. Thank you so much. Hats off to you and your staff. You guys rock, baby. And thanks for taking the time. I know you only had a little bit of time.
Keep up
here.
all the good work.
Thank you so much, Dr. Wolf. We'll talk to you real soon.
All right. Thanks for everything, guys. Okay.
All right. Bye-bye.
Thanks for joining us on the Dental Up Podcast Show this week. Make sure to follow us on Facebook, Instagram, and Twitter, or search the Dental Up Podcast on iTunes for our weekly feed. Don't forget to visit KeatingDentalArts.com/promo for exclusive offers. Keating Dental Arts is a full-service dental laboratory, and we're nationwide. We'd love for you to send us a case so we can show you the Keating difference. If you dig what you heard, please leave a review on iTunes, and we'll be back next week.